Good evening and welcome to the second Inside Government for tonight. This is a show brought to you by Cayuga Community College and shown on Spectrum, Verizon, Fios, Win 89.1, the college's radio station, as well as ARMA, the Auburn Regional Media Access, here in the city of Auburn. I'm your host, Guy Cosentino. We are delighted to have in the studio today Cayuga County Public Health Director Kathleen Cuddy for multiple return visits here, as well as Dr. Cassie Archer, the new Director of Community Health. So welcome to you. We've asked them on to give a health update. We haven't had you on, I think, since the spring. I know we're going to have some staff on next week to talk about the WIC program, but we've asked you both on to talk a little bit about what's going on in the world of vaccines and what's out there. And I know you had a great column in today's Citizen, which I encourage people to read, about the facts and fictions of vaccinations. Not that everybody will agree to it, and we'll talk about that in a second. So, for the first part, what is the job of the Director of Community Health? Because you hired this person.
Yes, well, we're so pleased that Dr. Archer is with us at the Health Department. The position, Director of Community Health, really oversees our clinical programs, which include immunizations, communicable disease, maternal and child health, and our WIC program.
And who had the position beforehand?
Our dear friend Nancy Purdy had that position prior.
Didn't want to leave it up to you. Why did you hire Dr. Archer?
Dr. Archer, I had worked with on the Board of Health, and she has always had a strong interest in public health, along with her excellent clinical skills. She also helped us during our COVID-19 pandemic, and when we were looking for a person to take the place in the vacancy that we had, we had some conversations, and she expressed interest, which we were thrilled about. So she came aboard.
So what did you do before this?
So I am a physician. I am double boarded in internal medicine and pediatrics.
What does double boarded mean? You're qualified in both?
Yes.
Okay.
Yes, I did a residency which allowed me to become board certified in both pediatrics and internal medicine, which is adult primary care for adults and primary care for children. And I practiced primary care for 20 years before transitioning to the public health realm.
And I know you were downtown with Joe Graney, and you were in that practice. That's how I met you originally. After you left that practice, what did you do for a while?
I served as the medical director of the primary care clinic at Liberty Resources, which is in Syracuse.
And deals with people with disabilities.
It serves patients with mental illness, substance use. It's now almost an FQHC, similar to East Hill.
Okay, what is that? What is you just?
Sorry, federally qualified health center.
Okay, so you had as I mentioned today, you had a column in the Citizen, which I did not plan on my end, but I don't know if you all planned on your end.
We did not.
Okay, so. You talked about the importance of vaccinations, so give us the 30-second, why are vaccinations important?
4 years of medical training now in 30 seconds, I got it. Vaccines are one of the most effective ways that we can prevent against illnesses that can cause people to have significant hospitalizations and even death.
So, you talk about this, but I want you to expand upon this idea of vaccine hesitancy. It's not just right this second, it's been going on for some time. What is your definition of vaccine hesitancy to start with? As she sighs.
No. I think that when you look at the population, there is a certain percentage of people who are going to take the vaccine as soon as it's available, as soon as you offer it to them, any vaccine.
Okay.
They're going to be like, yep, sign me up. There's another percentage of the population which is going to say, no way in heck am I ever getting any vaccine for anything. I don't care what you say. And then there is the larger population in the middle that says, okay, tell me about that. And that's where the health department can come in and teach people about.
So is that what today's column is aimed towards? Okay.
Yes.
It's not to the nevers and not to the always.
Well, I mean, I wouldn't mind to convert some of the nevers into maybe.
But has it become, but on that particular front, it seems in the last 4 years, it has become harder to do that. Obviously, it started with autism and questions about several vaccines and allegations of studies that say there were ill effects of certain vaccinations that caused autism. And at the same time, we have an overlay of COVID, where we have still people who still don't, they don't believe there was COVID, which I guess the numbers don't prove anything. Is it become harder to get over those? Were those the two big humps when it comes to vaccine hesitation?
Absolutely. The initial concerns from the Andrew Wakefield paper in The Lancet, which has since been discredited.
So explain what they are, because I know what they are, but viewers may not know what that is.
So Andrew Wakefield was a British physician who linked the MMR vaccine to autism. Subsequently, the paper was redacted from The Lancet, which is a huge medical journal.
It is the medical journal,
It is,
according to
yes,
many.
Yes, according
Okay.
to many. And he has since had his credentials revoked.
And
But
so-
yes, that did. Obviously, when you look at autism, you want an answer. There's not currently an answer, but definitely vaccines are not the answer.
I guess this is for both of you. Is this just an uphill? I feel like you're rolling this rock up this hill.
You know, I asked this question about hesitancy to Dr. Archer, and one of the great conversations and many things she brings to the table, and I think all good clinicians do, is you have a conversation. You meet people where they're at. You try to understand what is their reluctance or their concern, and then you can address that. And oftentimes, if you can meet people where they're at and address their concerns, then you can bring in further information that will open people's thoughts to the idea of something additional, something different.
So vaccines are important to you as an individual, if you get it, but they're also important to those around you. Can you make the case for that?
Yes, particularly in regards to in regards to childhood immunizations that we give for school, particularly the MMR vaccine, the varicella vaccine. Those vaccines are 99.5% effective about preventing anybody from ever getting the infection at all, and therefore spreading it to the population who might not be able to take advantage of the vaccine because the child has had a stem cell transplant or has an immunodeficiency, so those live virus vaccines are contraindicated for them. So not only are you protecting yourself, but you're protecting your community as well.
So those around you, your loved ones around you.
Exactly.
So let's talk. Oh, go ahead.
Sorry.
I'm sorry. No, please.
So for respiratory vaccines, particularly influenza, COVID, Tdap, which protects against pertussis, which is whooping cough, and RSV, to decrease the exposure of others to these viruses, can help protect them.
So let's deal with COVID first, because that still tends to be on people's minds overall. If you got the COVID shot last year, is it still good this year?
Currently, it's recommended for everyone over 6 months of age to receive the current vaccine, which is the 2024-2025 formulation.
So it treats a variant of what would have been in 2020 and 2024.
So the current formulation is targeted at the variant which is currently circulating in the United States.
And do we know at this stage locally, is COVID gone? Is it up? Is it what do you see from a health department perspective?
Cassie actually looked at some of the numbers and pulled them, but right now the only way we get data on COVID is if the diagnosis is made after a test is sent to the laboratory. The laboratory has to report the results to the state system, and then we receive it locally. So we would only see a fraction of those numbers, but we did see both anecdotally and statistically, August we had a few more, then it's tapered down. We are anticipating, and it will be borne out, that December, January we'll see more again.
So other than my wife putting a swab up my nose because I think she gets great joy of that. I don't know that I've gone anywhere where anybody's testing anymore. So are we still, is there, I don't know if I've been to a physician where it's been tested, unless I feel really awful. Are we testing as regularly as we were?
Someone who's going to the emergency room with symptoms that is consistent is getting tested. They're likely getting tested not only for COVID-19, but for influenza, RSV, and perhaps a variety of different viruses that can cause symptoms.
And when it comes to those getting vaccinations, are we seeing a drop-off from, obviously we're seeing a massive drop-off from 2020. Are we still seeing a drop-off now from, let's say, last fall?
I don't know if we have all that data.
We don't have local data, but based on this national data and statewide data, there's definitely less immunizations. I don't know compared to the 22-23 formulation, but certainly since the initial vaccine, there's been drop-off.
And so one of the drop-offs I thought I read in your column was among seniors. Why? They would be the most likely, to me, to get a flu and COVID shot, one on each arm. Is that been an issue for the last couple of years as well? So I think you had said that in hospitalization, I'm looking as if you have the column in front of you, but I thought the 12% number had come up.
Oh, that is of the number of the adults who were hospitalized with COVID-19, only 12% of those had been immunized. So the fact.
Okay, so the reverse of that would be that 88 weren't.
We're not.
Okay,
that's correct.
So to me,
but
that's
you're dealing with a
large
right.
But that's with hospitalization. I get that
right.
point.
Yes. And so
but
the point
kind
of that
mirrors society.
Well, the point of that was that people who end up in the hospital aren't vaccinated. So if you are vaccinated, you are less likely to end up in the hospital.
And you mentioned children. Remember at Herman Ave and a couple of others, there were schools that were doing immunizations at the school level. First of all, do any schools locally, any of the county schools, do COVID immunization now?
No. Schools generally do not provide immunizations.
So if I have an 11 or 12-year-old right now, 11-year-old at an elementary school or a 12-year-old at next door at junior high, where do they need to go to get a COVID shot?
That is a great question that we had been talking about earlier. Would you like to
So
answer?
the best place anyone should go to get their shot is at their providers, their doctor's office, your medical home.
So on that particular question, so originally, and this came to me as a question because it came up in a conversation, originally there was this issue you had to keep the vaccine very, very cold and you could only open it and there'd be only so much and it would spoil. Is that still an issue?
No.
Okay, so what from the miracles of science, what did they figure out?
So they've figured out that it does not need to be stored as cold, and we now have single dose vials, so we don't have to pierce a vial and get 10 doses out of it and make sure that we use all those 10 doses in the 6-hour window. And so,
okay.
So I don't know how. So that's a great development.
Okay, so I don't know how old you are. I do know how old you are. So when we were kids, we're not
I'm
that
not
far.
as old as you guys.
I know you are not as old as I am. But when we were kids, and I thought the world of your dad, Dr. Donnelly, we would go through a Congo line at our elementary school, and we'd get the sugar. What was the sugar? Was that
polio?
Polio. Mm-hmm. We'd get a vaccination, and that was always done at our elementary school. Did you go to Herman?
I went to Blessed Trinity.
Okay. So do we do those Congo lines anymore? And how do do all those children have to be immunized before they walk through the doors?
I love that you're asking that question because you're really leading up to what are the immunizations for school-age children. And while Dr. Archer did say, yes, a health home, having a provider is the ideal, we know there's various reasons why a child may not be engaged with a provider. It could be we don't have health insurance. It could be we just moved to the area. It could be we have a provider, but that provider won't be able to see me in time to meet my school age requirements. So this was really another year, another season has gone by where the health department becomes that safety net to make sure that children have their school age vaccinations. And you found some interesting data from last year as compared to this year on some of the school age children.
So our back to school immunization clinics were extraordinarily busy this year. We immunized 30 more children than we did last year, and a total of 50 more immunizations. And actually we're still doing some immunizations.
And a real mix of children who may have been on public insurance, and an increase in the number of children who had private insurance, but again, either might not have been able to get into the office in a timely manner, or their offices don't have the vaccines necessary, so they come to the health department.
And you still have to be vaccinated in what to go to school?
So to go to kindergarten, you have to have a certain number of DTaP immunizations, which is diphtheria, tetanus, and pertussis, MMR, chickenpox, varicella, and then as you go up in grades, prior to 6th grade, you have to have your Tdap, which is your tetanus and pertussis. Prior to 7th grade, you have to have vaccine against meningococcus.
And if you don't have them, first of all, if you don't have them, can you still go to school because there are exemptions, or are there no exemptions?
The only exemption in New York State is a medical exemption.
So no religious exemption?
There is no religious, no
Okay.
personal exemption. A physician has to sign off that you have a contraindication to receive the vaccine.
And then so it's up to all 9 BOCES districts locally to make sure that all that paperwork is on file before
Yes.
a child walks into school.
All their school nurses do a double check when the kids come to school, and that's often how we have, dozens more children come to us once school has begun, but before the deadline that vaccines are expected. And I wanted to go back when you mentioned where can children get their COVID shots. Yes, within their physician practice, depending on their age, they could go to a pharmacy, and then if they are not able to get them in those areas, they can call the health department.
And I know in the health department you all do a great job. But you're on Genesee Street, but you abut Dill Street, and I know
Correct.
there are people who come down there and got it. For flu shot, I know there's been some children who don't like needles. That would be 99% of them, I would assume. There's nasal occasionally for flu. Have they gotten to nasal for COVID yet?
No.
Okay. Do you see that on the horizon? Sooner than later, or later than later?
I honestly have no idea.
Okay. So let's go.
The only concern with the nasal flu is it really has to be targeted. It cannot be provided to anyone who has any medical issues that might increase their risk for influenza. So, for example, a child with asthma cannot receive a live influenza. Cannot receive.
And do you do nasal at?
We do have that available.
You do.
Yes.
Okay. A little too late for somebody a few minutes ago. Who should get the flu shot?
Everyone over 6 months of age.
Okay, and many people, I got mine a month and a half ago, and I will say I felt crummy a couple days afterwards. That may have just been my attitude, but why do we feel crummy sometimes after we get the flu shot?
So the point of an immunization is to cause an immune response, so that if you start making antibodies, and then if you are ever exposed to the disease that the vaccine is protecting you from, those are already available. You'll be better able to fight it off quicker. But when your immune system is activated, you can sometimes have aches and pains, feel a little like you have a low-grade fever and a little tiredness. It's not the vaccine giving you the disease. It's just your immune system saying, okay, I hear you.
And you mentioned Tdap. Again, what is that?
So Tdap protects against tetanus, diphtheria, and pertussis. Tetanus, people most know, is the disease that causes lockjaw. Diphtheria, no one's heard of, and it's very low incidence in the United States. And pertussis is whooping cough.
And you're always worried about that around, especially newborns.
Yes, if an infant gets
So who
whooping
should
cough,
get
they will.
Who should? I get the tetanus piece. Is it all one shot now that does all
Yes.
3?
Yep.
So it's a 3-for-1 option there. So everybody should be getting that.
Everybody should get that every 10 years. And
So
particularly
not 5 as we were told as a kid.
if you have a tetanus-prone wound and it's been more than 5 years, you may qualify for an early booster. So if you step on a rusty nail and your last tetanus shot was 6 years ago, you might get that a little sooner.
What's hepatitis B?
Hepatitis B is a virus that causes inflammation of the liver.
Is that separate from C?
Yes.
What's the
they're
difference
both,
between B and C?
B and C are different type of hepatitis viruses, but both of them can cause inflammation of the liver, which can progress to either liver cancer or liver failure.
With both?
And both of them can develop into a chronic infection with both of them.
And you can get a hepatitis B shot, vaccination, correct?
Yes.
Can you get a C?
No, there is no hepatitis C vaccine available.
Is that one that they're developing, they're looking at?
I hope so.
Okay.
Can you get a Hep A?
You can, and hepatitis A is another virus which can cause liver inflammation and failure, though doesn't turn into a chronic infection, and there is a vaccine available for hepatitis A.
So locally, statistically, do we have a problem with B and C?
Yes. Well, C is common.
Yeah.
It's common?
Yes.
And is it spread, how is hepatitis C spread?
Hepatitis C is spread through blood,
Through blood, and B is through?
sex and blood.
Okay. How about food handling?
That's hepatitis A.
That's hepatitis A, okay. So when, restaurant inspections under you too?
It is, yes.
Okay.
Which is one of the reasons inspections happen, to help prevent outbreaks like that.
So I want to ask about pneumonia, because I would tell you that I think I know more people. We were talking about this before. I think I know more people who've told me they've had pneumonia in the last 2 or 3 weeks, and I'm just shocked at the number.
Yes.
What's going on, first of all?
So there has been an increase noted nationally of something which is called mycoplasma, which is a bacteria that can cause pneumonia. It's kind of your walking pneumonia. The pneumonia vaccine protects against bacteria which is called pneumococcus.
So is pneumonia vaccine the same as a flu shot?
No.
Okay. So I don't know anybody who's got a pneumonia shot.
So
why do you ask for that, and who do you ask for that?
So the pneumonia shot protects against bacteria, which is called pneumococcus. Pneumococcus can cause pneumonia. It also causes blood infections, brain infections, ear infections. Children, it's part of their routine immunization series. For adults, it used to be something that we would recommend for everybody at age 65. Just over the last 2 months, they've decreased the age down to 50.
Okay.
So it is recommended for everyone over age 50 to have a pneumonia shot.
And is that something that's viral that can be contacted, or how does somebody contract pneumonia?
So pneumococcus, which is what the vaccine is preventing from, is a respiratory bacteria. So you can get it just like you
Somebody
get the
coughing.
flu. Yes, exactly.
Okay.
Yes.
So one of the other items in your portfolio is, which we've done full shows on, but I want to do an update, is on lead.
Yes.
And lead prevention. What is the issue locally? I know there has been an enormous amount of talk in Onondaga County. I know Mayor Walsh has been dealing with it in the county there. What's going on here in Cayuga County?
Well, in Cayuga County, like many upstate counties, we have older housing stock, and a very large percentage of our housing stock is older.
Within and outside the city of Orange, just
Correct.
not one area, correct?
Absolutely the whole county, right?
Top to bottom.
So if you built a house or you live in a home that was built before 1980, odds are that may have paint in it that was lead-based paint. And that was really good paint, so it was commonly used. Well, when paint, primarily, I'm focused on the paint for a moment, that appears to be the majority of our children who have elevated blood lead levels, typically from dust from the chipping and peeling paint. And the dust could be from the windowsill, it could be just from the floor, and it's just from opening and closing windows, opening and closing doors. So we have a few programs at the moment within the health department to address and help prevent lead poisoning. And it's focused on children, but certainly any age group, like we look at pregnant women too. We have the reactive program where if your child is tested for their blood lead at age 1 or age 2, we'll come in and help identify the sources of lead and help work with you on how to reduce those exposures. Now we have a preventive program where if you live in an older home, particularly if you have children in that home, you might be a grandparent with occasional visitor, then we'll go in and we'll do an assessment and help identify where there might be lead hazards within your home.
So 3 quick questions. One is, what are the dangers of lead for either of you?
Would you like to address that as a pediatrician?
So, yes, lead is a serious toxin for children. It can cause brain problems, developmental problems. It has been linked to hyperactive behaviors and
How
learning
about for
disabilities. For adults at high levels, it can cause anemia, GI problems.
And what are the symptoms? How do you, it's not like a cough.
Unfortunately, especially for kids, they don't have any symptoms.
So how do you identify that somebody's been exposed?
So it is routine pediatric practice to check all children's lead level at age 1 and again at age 2.
So it's not, there's no series of symptoms that you say, oh.
No,
It's
if you wait till you have symptoms, it's too late.
It is, okay.
Yes.
Do we regularly test children for lead, or is it only in specific cases where a physician or a physician assistant identifies a situation?
Family member bringing in a child for their pediatric visit should be assessed, really at every visit up to age 6, 7, 8. But at age 1 and 2, there's concerted effort.
And what happens if a home is identified with lead, whether it's owner-occupied or rental? What's the health department do at that stage?
So if I lived in a rental unit and there was lead paint there that needs to be remediated, the health department will work with you and with the property owner to fix that problem. And there are, if necessary, legal means in which the health department can compel that to be done. If it's the homeowner, then we'll work with you to identify the safe ways in which you can work to remediate.
All right, I've asked almost everybody who's been here, so I'd be remiss to not ask the 2 of you. Is the drinking water for Owasco and the city of Auburn safe right now?
It is. We do monitor that, and the city and the town constantly monitor the drinking water. But we receive reports not only from them as municipal purveyors, but all the other drinking water providers. We receive routine reports.
I noticed that when you sent me emails back and forth, I could look at things up on Facebook, which I do not have, but I'm a lurker. Or I can go on Instagram, again, a lurker, somebody's account in my house. You have gotten more into social media. Why and how's it going?
I'm really pleased with the social media outreach that our department has developed. And I give a lot of credit to our health educators who primarily focus on the outreach in that regard. We've had Facebook for quite a while, and that's great because we can put a lot of narrative along with some photos, and it's easy to do links. But we've really developed our Instagram page, which I think that hits a different demographic more so than a Facebook demographic.
But you're also doing YouTube.
And we also have YouTube, which has been wonderful to have videos on how to catch a bat, for instance, or how to can food. There's a lot of great information that's demonstrated on the YouTube channel.
A tennis racket and a fire extinguisher?
Avoid the tennis racket, avoid the fire extinguisher, capture that bat, and it can be tested.
But you can go to the counties, you can put in a YouTube video and ask the county health department what information's out there.
Absolutely.
Okay. We did not get to healthy neighborhood programs. We will have you both back in. Congratulations on your new assignment, and good luck with that. Our guests have been Cayuga County's Public Health Director, Kathleen Cuddy, and Dr. Cassie Archer, the new Director of Community Health. And I want to thank you for updating us on a whole lot of stuff. You're always welcome to the studio, as you know. We'll be back on Tuesday with a feature about women's, infants, and children, the WIC program, as they celebrate their 50th year. And we'll have Cayuga County the Cayuga County Health Department's Deanna Ryan and new WIC Director Tracy McMullen in to talk about that. This Thursday, Auburn Mayor Jimmy Giannantino will be in the studio for a city update. So you can send us your questions for all of them at cozguytho@aol.com. I'm Guy Cosentino for Cayuga Community College. Thank you for watching. Have a great couple of days, and we'll see you back here in the studio on Thursday with the mayor. Thank you. So the reason